Good morning, this is Jay Mann. I'm the owner of Amada Senior Care. I'm here with Zach Holt, CEO of Crater Community Hospice. Welcome, Zach. It's great to see you again.
Thank you for having me, Jay.
We've had a wonderful partnership with Crater Community Hospice for the last several years. Zach and his team have been just wonderful partners. I know that when I first started in senior care in the Richmond area, I had a lot of questions as to the different types of care modalities. And hospice was a question mark for me. I know it can be for a lot of people. You guys do such an amazing job with it. Can you help the viewers that are watching understand what hospice is and what you provide?
Yeah, sure. There is a lot of questions about that surrounded hospice because obviously a lot of people associate hospice with dying, right? Mm-hmm. And the reality is that the patients that we serve have a terminal illness, right, and they have a life expectancy of 6 months or less to live. So it kind of seems easy, trying to figure that out. But Jay, you and I are busy.
Right. We
know what it's like. We barely know what's going on tomorrow.
Right.
What are you doing in 6 months?
Sure.
You know?
Right.
I don't.
Right.
But now what happens if I tied that into an event,
right,
a holiday?
Right.
Christmas happens in the next 6 months.
Sure.
Thanksgiving happens in the next 6 months. Birthdays, holidays, anniversaries.
Right.
All of those things are important time to determine what 6 months looks like.
I see.
Right. So most of our patients have a life expectancy of 6 months or less from the time that we see them.
I see.
Right. So it's not always an easy, clear cut.
Right. So with that in mind, when is the right time to start a patient or a client on hospice and their families?
So again, we have to use what Medicare says is the 6 months or less determination.
Okay.
But then when a patient or family member that has decided that either curative treatment no longer works, or they just decided that curative treatment isn't the avenue that they want to go through,
I see.
And that's the time to call hospice.
So with that, a lot of times I'll speak with families when we who provide non-medical care, which is a completely different type of care, they'll say, well, my loved one is going to be on hospice. We're okay right now. What are the services that hospice provides when they're entering this phase of life?
Yeah, it's a great question. So we have a team. And hospice only works if you have a team.
Right.
So we have nurses that provide care. In our terms, they see our patients at least twice a week, up to every day.
I see.
To help us managing symptoms. That's where we're experts in.
Okay.
Our aides, our home health aides, work with your team if we're working along together to develop the right plan of care for that particular patient. Okay. We also offer spiritual care and our social workers go in and really help. Support. Volunteers are sometimes overlooked a lot in hospice.
Right.
Our volunteers are wonderful. They can sit with patients. They can help caregivers get to the store. Help patients get a chance to go to church.
Yeah.
Those are all important things.
So much feedback I've gotten about Crater Community Hospice and the representatives that you have, which are just loving, kind, warm, wonderful people. The job that your team does is without question wonderful, but it's you guys go even further in your involvement in the community, and that's something that's always impressed me about Crater Community Hospice. Can you speak to that and why that's so important to your company, to your culture, and to your deliverable?
Back in 1995, when Crater started, we started with support from the community. We were a true startup that involved volunteers. Okay. And so we feel as an organization that it's only right that we give back to our communities. Okay. Hence the reason why we have 2 thrift stores.
Yes.
Our thrift stores have a dual mission. One is to support our patients that are on service. Right. But secondly is to support our community with needs. We try to keep our costs low and our prices down, so that our community can benefit from the good need, goods and services that our thrift stores provide.
That's amazing. So Jay Mann here with Zach Holt, CEO of Crater Community Hospice, just doing a wonderful job in our community and serving the seniors. Zach, it is a pleasure working with you. I really appreciate you being here.
Appreciate you having me.
All right. This is Java with Jay. I'm signing off with a great episode, or from a great episode with Zach. Look forward to seeing you next time. Thank you.